Well, hello, friends. It's been a while. It's Dan McTeague, Canadians for Affordable Energy. We'd like to talk about the many topics, and there's obviously a lot to look at popping up almost every day as green energy prospects continue to hammer the bottom line for most Canadians. I think it's becoming pretty clear that when you have public officials involved with healthcare, like Dr. Theresa Tam, well known for her advocacy of lockdowns during COVID, now suggesting that the next step should be to look at climate change and the public and health outcomes. One has to start to really wonder if what they're promoting here is an agenda. And that agenda is kind of very interesting because I look at the terms of reference. We know that from last week, her comments in regards to a group of 21 so-called experts in science have concluded that Canada needs to do more on adaptability on climate change, as if we have not as a society been doing that before. But their report that was titled What We Heard, Perspectives on Climate Change in Public Health Canada, they're looking at several other factors that I think require a little bit closer scrutiny. And those include adaptation issues based on colonialism, based on racism, and of course, based on the idea that somehow several of the interveners here suggested that they were invited guests to North America. Look, I understand the idea behind being woke and the idea that you want to somehow invoke new social norms on the way in which the country is conducted. But if anybody wants to do anything about public outcomes in terms of healthcare, they can't deny the fact that there has been a significant improvement in the quality of life of every single person on this planet. And so if you're going to ask the question, how that happened, the correlation is simple. Our proper, our responsible, and our continued use of the resources this country has and is blessed with, including, notably, fossil fuels like propane, natural gas, that turns into the kind of things that we need to improve our medical condition, things like our surgical masks, things like the equipment, the pills that we use. That combined with human know-how and technology has bequeathed to this generation something far more than the regressive idea that somehow human interaction is in of itself bad. I think it's a little unfortunate that we have people who are public advocates using the issue of healthcare as a means to cross over into areas of which they have no expertise. The climate is extremely complicated and extraordinarily difficult to comprehend. But to suggest that this should somehow be a political movement for those advocating some kind of virtue signaling, in my view, is wrong-headed, irresponsible, and ultimately it leads to the public's lack of confidence in institutions. In a word, Dr. Tam should stay close to what works for her. She should stay in her lane. I think it's important that Canadians understand that if we're going to do anything about the weather, about the climate, that we continue doing what we're doing in this country in a very responsible way. To do otherwise, as suggested by experts obviously with an agenda, and for whom there would probably no work were it not for finding new ideas that have nothing to do with the purpose at hand. Were it not for these things, I think many of them would be unemployed. That's really all I have to say about this because it's significant, but not surprising that for some of us who had reservations about Dr. Tam during COVID, it's now been exposed that they're in fact pursuing an agenda that does not have the best interests of Canadians at heart, and more importantly, is based on platitudes and false assumptions, which at the end of the day divide Canadians and do not get us any closer to ensuring the sanctity and the importance of our healthcare system.